the question of whether or not we expect it to infect everyone, I want to point out that given the basic parameters of Omicron that we've estimated, Omicron ought to have infected way more people than it has. The fact it hasn't says something about the contacts that we're allowing it to spread among and the state of immunity within the population as it is. Neither of those things are going to remain constant. So it's going to carry on. Also, don't count Delta out. Delta is not as obviously immune evasive as Omicron, but it does have the ability to sort of outpace the immune system by replicating very quickly before the initial B cell response gets kicked off. And so Delta is currently very rare. Delta was very rare in South Africa. Don't mistake the fact that Omicron grew quickly in that context as meaning that Delta is necessarily going to go extinct. But the point is, the wider point is very large numbers of people are going to be infected with Omicron. At some point, almost everybody is going to be having some encounter with the virus. And the immunity that will result from that is going to mean that the next time they see the virus, they're less likely to be ill, severely ill. And so that is an important factor. Now, I would point out that if the way to get that immunity is not to get infected, the ideal way to get that immunity is to be vaccinated, because you're then acquiring the immunity without the risks of infection and without something that you can transmit to other vulnerable folks. So get vaccinated. I'm sure most of the people listening to this are vaccinated, if not boosted. If you are actually in one of those communities which are under-vaccinated or not boosted, and you are in a position of authority and trusted, please speak to your fellow citizens. Please try and encourage them to be vaccinated and boosted, because that's going to do a huge amount to prevent the worst consequences of Omicron, and indeed whatever comes after Omicron.